Hi, this presentation is an introduction to opioid use disorder. In it, I will answer the questions: what are opioids? How do they work? What is an opioid use disorder? And how do you know you might have developed the disorder? So opioids are natural or synthetic chemicals, meaning that they can come from nature. For example, this opium flower over here, or they can be manufactured in labs. They're used to reduce the feeling of pain. They come in different forms, and those different forms of opioids include prescription pain relievers, synthetic opioids, and heroin. So how do opioids reduce pain? Imagine this green particle over here being the opioid molecule, which is the smallest particle of the pill or whatever form the opioid comes in. What it does is it binds to another bigger molecule called opioid receptor, which sits on the nerve cells in our body and our brain. So imagine this blue is that big receptor. The green is the opioid molecule. They bind to each other, and then a lot of other reactions take place, which eventually leads to reduced pain. Now, this process can be beneficial if it is used for a short duration of time for pain relief, for example, after surgery or a fracture, but it can become problematic, and when it does, it develops to become a disorder called opioid use disorder. So what is an opioid use disorder, and how does one know that they have developed it? Well, it's a problematic pattern of opioid use plus any of the two following 11 signs. So in the remaining of time, I will present those 11 signs that will help identifying that you might have developed an opioid use disorder. The first sign is when a person uses larger amounts over a longer period of time. For example, they've been prescribed certain medication, for example, oxycodone, for twice a day for 1 week after their hip surgery or as a part of their low back pain management. But they find themselves using more than twice a day, for example, 4 times a day, and even after 2 weeks have passed, they still use it, which brings me to the second sign, which is when they cannot down or control the opioid use. They understand that they need to use it twice a day, but they cannot control it, and they end up using it more frequently. The third sign is when a person finds themselves spending a great deal of time obtaining or using the opioids or recovering from their effect. They can wake up in the morning, for example, and go 2/3 of their day trying to obtain the pill or heroin or whatever form they're using, or they are experiencing some side effects or withdrawal symptoms, and it takes up majority of their time. The fourth sign is craving or a strong desire or urge to use opioids. The fifth sign is when they experience problems fulfilling obligations at work, school, or home. They show up to meetings late, they don't turn in assignments on time, they don't do their chores at home, and eventually that leads to the sixth sign, which is continued use despite having recurrent social or interpersonal problems. Of course, when you're late from all of the meetings you're supposed to be at, if you're not responding to your friends' calls, or if you're not there on special occasions in your family, you will have many damaged relationships, and that will in turn lead to even deeper interpersonal problems. And all of this as a result of an opioid use disorder. The seventh sign is when you're giving up or reducing activities because of opioid use. You stop going to the gym, going hiking with your group, and even when there's physically hazardous situations, for example, there's a fire, you still continue doing what you're doing, and you don't stop and look around and try to save yourself or save somebody else. This is the eighth sign that you might have developed an opioid use disorder. The ninth sign is continued use of opioids despite ongoing physical or psychological problems likely to have been caused or worsened by opioids. So this person here, she's suffering in this vicious cycle of using the opioids despite having psychological problems because of it. And then she feels so physically drained and mentally down, she feels the need to use opioids to help her feel better. Is tolerance, which is defined as need for higher doses, or if a person uses the same dose, they have diminished effect than the previous time. This motivates them to use more. This tolerance can develop as early as 2 weeks, which is dangerous because a lot of times the pain medication could be prescribed for 2 weeks. This is why we have this epidemic, and these numbers showing that 45% of people with addiction have developed addiction because of initially prescribed pain medications. The 11th and probably the most important sign is symptoms of opioid withdrawal. The suffering man here is experiencing muscle aches, sweating, chills, tremors, nausea, vomiting, diarrhea, and because the symptoms are so severe, it creates significant motivation for him to continue using opioid to prevent withdrawal. This person is suffering from all of this, and the chances are very high that he's going to get up and start using again. Talking more about the withdrawal symptoms and linking them to the unique features of opioid use disorder. While this disorder is similar to other substance use disorders, in many respects, it has several unique features. For example, opioids can lead to physical dependence within a short time, as little as 4 weeks. In chronic users, the abruptly stopping use of opioids can lead to severe symptoms, including these listed on the slide. Those include generalized pain, chills, cramps, diarrhea. Of note, very intense craving is one of the withdrawal symptoms. So you can see how this can lead to use with even more frequency and increased doses. And as with other addiction disorders, both genetic factors and environmental factors, such as ease of access, contribute to the risk of disorder. So it matters what your social circle is like, where you live in, who you're surrounded with. Access to prescription opioids, to heroin, have contributed to the current opioid epidemic. According to the American Medical Association, an estimated 3 to 19% of people who take prescription pain medications develop addiction to them. People misusing opioids may try to switch from prescription painkillers to heroin when it is more easily accessible to them. About 45% of people who use heroin started with an addiction to prescription opioids, according to the American Medical Association. So all of this to say that this is a disorder, this is a problem, and it is not just you.